Happy Motivational Monday. Hi, it's the nursing professor here. And today I want to talk about this big, beautiful bill that we have and its impact on healthcare. We already know that it's going to impact our patients and that they're probably going to avoid getting preventative care because it's not going to let them be seen unless they have a copayment. You know, those days are gone. Telehealth will be gone. And they're going to utilize the emergency room urgent care and get kind of patched up until they decide to come back or until they're in a critical state where they will have to be admitted. All right. So number one on the list is going to be its impact on long-term care and skilled nursing facilities. Now, we know that these facilities are in business to make money, and primarily they are funded through Medicaid. And so if there are Medicaid cuts, then that means that there's going to be a cut in the number of dollars that these facilities get. So if you work for one of these facilities, what is that going to mean for your future as far as 401k plans, any raises in the future, staffing requirements? What is that going to mean for that? Because somewhere, somehow, some cuts are going to have to be made in order for that facility to still make money. All right. Number two on my list is that there was a mandatory staffing bill in place put in by CMS, Center for Medicaid Services, and that has been delayed. It's not even going to be talked about until 2034. So finish with that. Number three, it's going to reduce the clinical training sites that our students have available to them. So we already have a concern that our students aren't necessarily practice ready, right? Because they don't get the same experience all the time that they got prior to COVID. So now you're going to more than likely decrease the number of occupied beds in an acute care setting because nobody's going to come if they can't afford to pay for it. And so most of the services rendered in healthcare will be outpatient, urgent care, emergency room, and it is going to burden that staff so much. And the inpatient beds will probably be empty until the person gets in a critical state. And at that point, then those numbers get smaller and smaller as far as opportunity for our students to learn outside of a simulation lab. So we already know we have a bit of a problem with practice-ready graduates. And so this is going to make that more prevalent as our nursing students graduate. Number four on the list is student loan changes. We know that student loans have been capped. I believe it's like $20,000 a year. In many places, that's not going to be enough for 1 year tuition. And so what it's going to do is it's going to burden the student more by getting more private direct student loans that are payable even when you're in school. So there won't be any forbearance. There won't be any loan forgiveness because you're a healthcare person, none of that. And so that will more than likely become the way of life in order to pay for your degree. Now, one of the things they're going to say is positive is that it did increase the amount of Pell Grants that can be distributed. But the caveat is this: those Pell Grants are only for short-term programs that are between 8 weeks and 15 weeks. So there is not one registered nurse program that you can complete within that time, not one licensed practical nurse program that you can complete during that time. So the only thing that it's going to allow you to get is more nursing assistants. Do we need more nursing assistants? Yes, absolutely. But it's only a proportion of the population that it will actually give an opportunity to. It's not going to give an opportunity to anybody who wants to go into healthcare and to further their degree. All right. And so therefore, it's going to put more and more financial stress on our students. And you have to wonder how many people are going to still be able to complete a college degree as a result of that financial burden that they will take on. So those are just some of the things that I've been able to extract from the big, beautiful bill. I'm sure there's probably more. If you know of something that's going to impact you or that you've learned about your facility, just drop it down below and let's talk about it. And so that brings me to the point, what can we do? Okay, so our voices still can be heard through national associations like American Nurses Association, Black Nurses Association, Critical Care Nurses Association, any of those specialties that have their associations. So if you haven't joined one before, now might be the time to join one, because we're the largest group of healthcare professionals that exist in the United States. And so there's no reason why our voices can't be heard. And this is going to be so important to keep the population of America healthy. We've been working and working and working at it, and we're now to the point where we frequently get some preventive care done in our communities. But now that's going to pretty much go away because people are going to be afraid of acquiring a new bill. So let's talk about it. I'll see you next video. Bye for now.